long time, but I am Courtney Herring, and mostly what I do is I do build private practices for people from start to finish. The other reason why people contact me is because there might actually be an issue with your private practice. So let's kind of get into some of the things that I definitely wanted to talk about today. So I had a post today, which I thought was really interesting, and I'll tell you why. So, as a healthcare professional, one of the things that we do is we trust other people to update some of the items that have to do with our licenses or so on and so forth. So, I will give you an example. Let's say that I work in a new company and that company actually asks me for a lot of my different information. It could be my DEA license, my LCSW license, whatever my license is, they're going to ask for that, which is totally fine. That is okay. But one of the things that a lot of different agencies do, and even hospitals, they are also billing for your services. Since they are billing for your services, this is kind of the public statement announcement that I want to make to all of you. Yes, they're billing for your services. So, therefore, you might give them something called CAQH. Okay. And if you do not know what that stands for, it's a long kind of thing, but this is, it's crazy for like honestly what it stands for. But CAQH is a nonprofit organization that basically helps you make sure that you have everything that you possibly need. And when I say that, that's where your licenses are being kept. That's where a lot of your stuff is there, okay? So CAQH, what it actually stands for is the Council for Affordable Quality Healthcare. Again, it's a nonprofit organization dedicated to the simplification of the administration of healthcare. So that's basically what CAQH is. And I'm actually going to show my screen because I'm going to talk to you about some terms of services. The reason why we're going to talk about this is because I've been going over this with a lot of different healthcare professionals on how to make sure that they are keeping all of their information safe. And this does not mean, number one, that you cannot give your information to other people. That's not what that means. But what that does mean is that you are responsible for it. Okay. So I'll give you an example. If I were to give someone my debit card and give them my username and password, something that my bank says when I even create that account is do not share that with anyone else. And basically, once you share that, you are also not following their terms and conditions. And also, you basically gave them rights to, in some form or fashion, a way for them to take money out of your account. We all know there's other legalities. Yes, you can go back and you can sue people and all this stuff, but the whole point is that you want to make sure that you're protecting yourself. It's the same kind of concept that I'm about to explain to you right now. So let's go back to I'm starting a new practice. I'm working somewhere. They ask me for my CAQH username and password. They ask me for my NPI username and password. All of these things are used to update addresses, add your licenses, and just make sure that all of these things are there so that people understand that you are a provider and you are able to provide services. We also use these registries, and I'm not going to go through all of them. We all know that that's not the only ones. But we also use these registries in order to, number one, gain employment. And then number two, also for credentialing services. CAQH, a lot of times, which is wonderful, we are actually able, meaning, like, let's say you wanted Blue Cross and Blue Shield. Blue Cross and Blue Shield is able to take your CAQH ID number and take all of the information that you have put in there into their system so that you don't have to retype everything. Now, for each and every insurance, that is not the case, but that is not the issue at hand that I am discussing. What I am discussing is you are still responsible, no matter who you give all these things to and you're working and all this other stuff. I get it, but you are responsible for your information and how your information gets out into the world. So, we're going to go over a couple terms of conditions just with CAQH. But what I'm going to tell you, it applies to mostly all of the passwords that you're giving administrative assistants, that you're giving other people who at an agency. All of these things apply. So let's go ahead and just look at my screen, and hopefully everyone don't judge me for all the tabs that I have. But let's see if we can kind of, go up there. All right. So, of course, something's going on, but I'm going to basically just read it to you, okay? Because it's being weird for me to share it, okay? So with CAQH, what they are saying is you are entirely responsible for maintaining the confidentiality of your password and for any and all activities that occur in association with your account, whether or not authorized by you. If CAQH, receives a request to disclose, alter, amend, or delete your information and your username and password are provided, basically they will go ahead and update those, okay? You may not use anyone else's account at any time, and you may not allow anyone else to use your account at any time. You agree that CAQH will not be liable for any loss you may incur as a result of someone else using your password or account, either with or without your knowledge, and your future agreement that you will be liable for losses incurred by CAQH or another party due to someone else using your account password. So let's really unpack all of this. And this is in, banking information. This is in all credentialing. This is in everything, honestly, that even we do, just as regular old people, okay? But as a provider, when you give your username and password out to other people, and I just literally read the blurb, you can actually find this on CAQH. It is underneath the general CAQH general terms and conditions. It's maybe about, it's in section number 3, user accounts, go down about 6 paragraphs, and you're going to see it, and it is in bold letters. Now, why am I talking about this to you? Well, what you might not know about me is because I'm very knowledgeable in many different aspects of healthcare, a lot of people contact me. So lawyers contact me for maybe like Medicaid fraud. Investigators will contact me for questions on how do I do this, or why was this done? I don't understand. I get contacted by a lot of people in order for me to consult and assist them with things that don't make sense to them because they're not really in the healthcare world, but they are trying to defend their clients. Well, this is something that they cannot defend. So let's go through this. What occurred was there was a doctor that is now saying that an agency did not have the right to actually credential him. Now, that could possibly be true. But the issue that is at hand is that in order to credential you, there has to be signatures from you. There has to be passwords that were given to that agency by you. You have to give them everything. How does the credentialing service have a copy of your DEA license? How does the agency have a copy of your social security card? How does the agency have a copy of your, it's clearly a copy of all of your information. They didn't just get it out of thin air. So this is what happened. This person was going to work at this agency. A credentialing agency was contracted to credential this new doctor. The new doctor has worked all over the place. As things were sent to this doctor, he continued to sign different things. Then, when the doctor now is no longer getting paid for certain things, maybe something happened. We don't have to go all into it. But the point of the matter is that he didn't know that what he was signing. Even though it's been sent to him, it was all signed, he didn't read it. But this also would not have happened if all of this information was not given to them, number one. And then also number two, it would not have happened, okay, if he went into his own CAQH to see that there was constant updates of this new agency. So I'm going to tell you exactly what just happened. What happened is he is at fault. He is liable. This is now a problem. Now, I totally understand that this is a mess. I have assistants. I have people that do so many different things for me. But what I want to make sure that everyone understands is I believe in something called this. You automate, so you go in there, you figure out what you're doing, and then you delegate, right? So somebody's going to do it for you, but you still need to look and make sure that that's even right. Are you even working at the place that possibly could have some of your information? I also do believe in changing your password as much as possible. If you're a hospitalist and you're working at like 5 hospitals, we all need to make sure that you update your NPI information. If you go to your NPI right now and you see all of these things and places that you've been working and it's out of date, that's not good. Okay, that's not good, but it's your responsibility. And why is it your responsibility? Because it's your username and it's your password. So there's something that I want to say. You don't necessarily have to give out your password to everybody. There's actually things in CAQH that allow administrators to assist you to update these items so that you have a log of who is actually in your account and it doesn't constantly look like it's actually you. That's why you're liable. So because I am unable to share my screen, again, you can go to CAQH.org and usually it shows up as ProView. I want to explain the screen that I'm actually looking at. So CAQH Solutions ProView. It has on the right-hand side, as I'm looking at my screen, sign in, username, forgot username, all that stuff. But it says, first time here, if you are a practice manager, sign in, you can create something like that, okay? So what I'm saying is if you're hiring somebody for something where they need to get into your CAQH, this even goes to any organization that you're working with. CAQH, as well as other insurance companies, NPI, all of that stuff, they have a way for your office manager to be able to go in and update your items. But guess what? You still have to go in there and actually hit the button and say that's correct. That's how there's checks and balances on how to make sure that some of the things that I'm talking about do not happen to you. Because giving out your username and passwords for CAQH, just because someone told you that's what you do, that's actually not what you do. What we do in our agency is we have our own username and passwords. We go into CAQH, we update your information, but you get an email, you get a prompt into your CAQH, and it cannot be updated unless we have your consent. And that, my friends, is how you credential. That, my friends, is how you update your CAQH, PICOs, NPI, all of those things. You don't give out your actual username and password. It is up to you. That is your information. So I understand, and I know I'm going to get a lot of like different people like, oh my gosh, what is this? There is a way for you not to do that. These companies know what happens. People, and you're not lazy, you don't know any better. And you don't know better because people also don't know. But what I do know, if you're educated, especially in credentialing, if you're educated in how to actually assist healthcare providers, then you're going to know that. So the next time that you hire a credentialer or even a biller to assist you with your electronic data interchange, your electronics admittance advice, your electronic funds transfer, they don't have to have your user name and password. They can, one, either make their own. You can make one for them, maybe if it's an electronic health record. But I want to stop the narrative where, oh, this is what my employer said that I do. So let's kind of go into that. I don't care what your employer tells you to do. It's about what's right. And whenever you create something online, it strictly tells you, even Facebook tells you not to share your username and password with other people. There are other ways that they can update your stuff because you are actually the person that needs to make sure that this is happening. Okay? You are the one that has to say, oh, this is okay, right? But if you give them your username and password, guess what's going to happen? People are going to do whatever they want, and then your excuse is going to be that you don't know. And that's not how it works. That's not how it works. When you sign something for terms and conditions, that's not how it works. It's just not how it works. How this works is that you're responsible. So again, let me give you some really great tips. If you hire somebody to credential you, they don't need your username and password. What they need is they need to create their own, or you're going to have to create it for them. So yes, you're going to have some skin in the game, especially if it's CAQH. You all know, I believe you have to attest it off the top of my head, I think every 180 days. So you should be looking at your own CAQH. You shouldn't just be practicing all over the place. You don't know what is going on with all of your stuff. Let's be honest. Everyone is not honest. You don't know who works at these agencies. They have your DEA license, which means I can call Walgreens right now and call in a prescription, okay, at that point. So you want to know who has all of your stuff so that you're aware. But also you want to make sure that if you just don't give them your username and password. That's really all that I'm saying. And I know that this might be eye-opening for people, but you can even go to YouTube. CAQH will tell you exactly how to do that. PICOs, NPI registry, CMS, they'll tell you how to do that. Any insurance company, One Health Port or Health One Port, they'll tell you how to do that. But the reason why it's important is because everything that person does, you have to actually approve it so that there isn't, oh, I didn't know. Well, no, you didn't know, but guess what? You're responsible. You are responsible for your license. You are responsible for all of your passwords. So I know that this is hard for people to sometimes hear. And I'm not here to chastise anyone. I'm here to make sure that you're safe. I'm here to make sure that prescriptions and different things are not being, called in by some random person who has your DEA license, your NPI number, and all this other craziness. Yes, we do know that some pharmacies don't really check. Some people call in, medication. How do they really know that it's you, right? So start also checking your controlled substance reports and making sure that the patients that you actually had are the ones that are actually getting it filled. Okay? Because again, you are responsible for your license. You are responsible. So you can sue anyone that you want. But I can tell you right now what happened with this one person, because I do work with many different people. As I said, investigative lawyers, people that investigate Medicaid fraud, because I also bill, people that have issues with, credentialing or some kind of compliance issue. I have people calling me all of the time to ask me, what would you do? Or is there another way? Or can you please explain this policy and this process? And this is why I am who I am today. I believe in healthcare. I believe that healthcare providers are one of the heroes of America. But I will tell you this, your username and passcode is your username and passcode. And I'm not going to repeat it again, because I'm going to tell you, in the court of law, you're going to lose. You have to make sure that you know where it is, and you need to make sure that you know what it is. And I would also suggest to change that as well, just because that keeps you safe. And that creates an environment where other people can't do certain things to you. So I'm going to end on that. I do want to let you know that on Saturday at 2 p.m., I will be doing a LinkedIn audio, and we're going to talk about private practice. We're going to talk about building, private practices. And I want you to be able to ask me questions. Also challenge me. Something happened, this is one thing I always tell people. You can tell BS and people that can't really do their job if you get them on a live or you talk to them and they can't answer the question. But I will tell you this, I'm also an honest person. If I can't answer the question, I will find it out, or I will tell you that I don't know. But I do know a lot of stuff, and I know a lot of stuff that has something to do, especially with healthcare and policies and procedures and what is real and what is not. And I'm going to tell you right now, when anyone asks you for their username and password, a lot of times they're not trying to be malicious. They just don't know that there's another way to do it. So unfortunately, I am here to try to educate you as the provider and also educate other people who are doing some of these things that are also in medical practices. So again, I am going to end. You guys will see me so much more. Mississippi is extremely hot, so it is tank top day, but I hope all of you have a great day, and don't share your password.